not with us today. But I'm going to turn it over to you. Thank you so much for being here.
Thank you so much, Christy. And thank you, Selby. I'm really excited to know I'm not the only person that hasn't attended this meeting. I think this is my first meeting, so I'm glad to know that I'm not the only one. It always helps to know when you're not alone, right? So thank you all for showing up today. And I hope that you come away with something that is of benefit that you can use in your work and maybe for yourself at the same time. My name is Marietta Gary Smith. My pronouns are she, her, and queen, which is reserved, and I am a health equity strategist. I'm the health equity strategist here at HealthShare of Oregon. And I get the chance to work with the delightful Selby Stebbins. We've been working together on another project, and it's been really great to just engage with a colleague who is as present as I am in the work that we're doing. And that's not to say that other people can't be present, but I'm quite sure I'm not the only person on the screen that has experienced working with someone and recognizing that you might be the only person who's pretty present in the work that you're doing. And so I appreciate the opportunity to work in collaboration with Selby. I'm delighted to be here to share with you this afternoon just my own experience from my lived experience as well as my professional understanding around what does authentic engagement look like when you're working across diverse and intersectional communities, right? And so I want to start off by saying that there's a lot of talk that people can give you. I'm not the only person, and I'm certainly not promoting myself as the best person. But what I do have to offer is that there is a lot that can happen in the head, but I'm someone who works with head, hand, and heart. So I'm going to ask you to bring all of those things with you this afternoon, right? To utilize your mind to be able to comprehend and understand what makes sense for you. I want you to consider your heart and think about what you are feeling, right? So feelings aren't facts, but they do inform how we make decisions. That's my word, right? So what is happening in your heart and in your body is important. That's information and data, and it is absolutely necessary to be cognizant of what's happening as we're going to have this conversation. And I hope it's a conversation. I'm someone who likes to engage. I'm from a community that really appreciates call and response, right? So this doesn't have to be just me talking at you. I don't like being talked at, and I try my best to not do that when I'm offered the opportunity to be in shared space with folks. So I'm asking you to think about how you're feeling. And then the takeaway is, what are you going to do with your hands? How are you going to utilize the information that you get here that makes sense to you, right? That's helpful for you, that seems to be of benefit to you. How are you going to utilize that in your daily practice of how you engage in doing your work and engaging with folks? What I hear from all of you who have shared your roles and what you do is that you are actually, your hands are, as my grandma would say, your hands are getting dirty. You have your hands in the communities and on the families and the folks that you're working in service to and for. And so it's important to be mindful that you all are the resource for the folks who are seeking support. You are the resource. You are the touch point. You are the touchstone that a lot of folks look to be able to get services and access to services to help them from where they're at to where they want to get to. And so how can you use your hands to be able to utilize information that's of benefit that will help you do your job differently to be of support and of service to those folks? And the last thing I want to offer is to be mindful that many of the people that we're talking about aren't in the room. I encounter that a lot in my own work as someone who is from a community that has historical impacts of harm and trauma. I'm often brought into the room or into a space because for whatever reason, I'm the person that is considered safe or approachable or the most accessible. And yet I'm not speaking for myself. I actually take on the responsibility of speaking for folks who are not invited into the room, for folks who are not able to be present, for folks who may not have the language or the ability to speak their truth without fear of being harmed or something happening to them if they do tell their truth. So I want to offer that consideration to you. All right, let's get to the good stuff.
Hey,
And
Marietta,
yes,
we're not seeing your screen if you
I'm
were.
getting ready to
Oh,
put
okay.
it up now.
Oh,
Thanks for
wonderful.
keeping me on track, Christy. I appreciate it. All right. So are you all able to see the screen? Awesome. Thank you. I'm actually gonna resize so I can see all of you. It's important for me to see you as much as anything else.
Yeah, we're not, it's not showing the like the presentation view, it's just showing the slides. If that's
Okay, let me stop real quick. Thank you. Okay. Let's try this again. Is that better?
Yeah, looks great.
Yay. Thank you. Thank you, Christy. So what we're going to go over today, and we've already done a great welcome with a great question, Christy, I'm going to utilize that question and give you credit the next time I pull it out of my toolbox. And I've offered some expectations in terms of what I hope you all come away with. I'm going to briefly go over some of the language that is used that you might use a lot or you may hear a lot in some of your work. And if you don't, this is an opportunity to consider some of the words that people use when we're talking about historically impacted communities. These are some of the words that are used to describe conditions or settings or what's happening to folks and how it plays into the concept of equity in terms of being able to cast a wider net and to ensure that access is provided and gifted to all folks. As someone who's a health equity strategist, the way that I approach my work is that I utilize social justice as a practice of how I do my work and the focus of care, because you all are providing care in a very real, tangible way. And so what does it look like to talk about health equity as a practice of social justice in the ways that you all provide your care to your clients and patients and community? And then finally, to touch on, so like, what is your work and your role in creating the opportunities for authentic engagement? As much as you are about doing your work, there's an opportunity every time you're engaging with someone to create a space, to create a curated experience for someone where they're able to connect with you in an authentic way, in a transparent way, in an honest way. And this isn't about you sharing things that are potentially hard for you. This isn't about disclosure, right? I'm also a sexuality educator, so I have to consider what does it mean when I'm talking to young people or parents or other folks about sexuality or sexual health. Disclosure is one thing. It's important to be able to share an experience that someone can connect to, that creates an authentic moment where someone is able to learn and take away a nugget of understanding that's helpful to them. So what is your opportunity to be able to create that from your own personal experience? Or from the experiences that you've witnessed, right? So you don't have to necessarily go through something to understand when someone's been harmed, when someone has experienced a trauma, when someone has experienced a moment of disappointment, right? And then what does actionable accomplishment, that's my words, what does that look like, right? I understand people identify as allies, and I think that's great. For me, I believe in accomplishment because that means that you're willing to give up something. You're willing to release something. You're willing to sacrifice something. And if you're willing to release and relinquish power or positionality or privilege, that means that you're able to stand in solidarity with me, knowing that we're going to be tied and connected. Our success, our freedom, our liberation, whatever word you like to use, is connected in us being in solidarity and in relationship with each other. So if your work is about helping folks get access to services, if your work is about helping people realize better outcomes than where you beat them at, accomplishment can play a significant role in how you create authentic space for conversation and engagement. Y'all with me so far? Okay. All right. So this is the definition, excuse me, from the Robert Wood Johnson Foundation around health equity. And so what this is showing is that that this is this is really specific in terms of the concepts and ideas that are based on human rights, right? And so it's important, I think it's important for me, as someone who works in the healthcare industry in a very specific way. If the intent is to make sure that people are well, you absolutely have to have a paradigm that believes that first. You have to work from a foundation in a place where people are thought of as being able to actualize what being well looks like for them, and not how we want it to look or how we define it, right? And so that's what this definition speaks to, and it names some very specific things, right? Removing obstacles, removing barriers to their health, such as poverty, discrimination, and their consequences, right? So again, it's about being a bit more expansive in terms of understanding that people are in situations and they have the opportunity to get out of those situations, but they don't deserve to be punished either for being in those situations. That there's a thread of compassion that should be part of the experience when we're working in service to and for folks. So we're going to get into a few words, and my intent is to not run through these, but to encourage you to open up, come off mic if you'd like to talk about if you've heard these words or how you've heard them used, or if you've used these words and how you use them in terms of your work. So the first word is prejudice, which is what I consider a simpler term, right? This is something that a lot of us engage with in terms of hearing the language or talking about an experience of prejudice, right? And so I'm not going to read these because I am of the mind that y'all are educated folk, and so I don't have to do that. But I think it's important to understand that prejudice is very much in terms of understanding how social services and providing service and access to service for folks. This is a concept that is filtered within how a lot of our work is done, that there are prejudices that are held around folks who might have addiction issues, for example, or folks who might have experience with the criminal justice system. Like there are already prejudgments that come from our own experiences, whatever those might be, or experiences that have been witnessed. And so these are the kinds of things that we actually have to start redefining and reframing for ourselves when we're talking about building opportunities for authentic conversation and engagement. The next word is power. I think this is also another way to be another opportunity here to be clear about how something that is unseen, almost like the wind. You don't know the wind is present until you feel it. And so with power, there is an opportunity to understand that for someone who has access to resources or folks who make decisions about how other people can receive access or services, there is an ability to influence, an ability to soften the way things go. And so I want folks to consider, and this is an opportunity to engage in some conversation here, like what are some examples of how power impacts your ability to do your work? What does that look like for you? And then what does it look like for the folks you work in service to? And I use the phrase in service to. So when I talk about my work on a regular basis, I say that I work in service to and for the communities I represent and serve. And so for me, I'll model what I'm asking folks for if you want to participate, and it's absolutely okay if you don't. Some of the ways that power shows up in how I do my work is that my concept and belief of how I think equity should function as a strategy isn't necessarily the way that those who are in the in the decision-making positions think about it. And so the power they have to define what my work should look like is not in alignment with how I function and how I make my decisions about what my work should look like. There's a power differential because they are able to say yes or no to my ideas or my concepts. And so for those I work in service to, what it looks like is me sometimes having to say, as much as I would like to help you, I can't because of A, B, and C. Or for me to say, I know that I'm not able to help you in this way because of the decisions that are made. However, these are the ways I'm able to help you. Is this something that we can work in collaboration on? But what it creates is friction and not being able to do the work I feel in the best way or in a way that doesn't actually service the folks that I'm working, folks that I'm collaborating or working with. Does that make sense? Okay. Does anyone want to share anything about about their experience of power or how power may impact them and how they do their work?
I can get the ball rolling. And I had so many different ideas going through my head, but two that were coming up for me a lot were a lot of resolution of barriers in system of care work. We use this phrase that it requires funding or policy change. And I think a lot of us feel very disempowered quite frequently that we don't have any or we question our own ability to impact funding and policy changes at all and feel very disempowered from that. And then I was also thinking about the phrase, the ability to influence others, and again, how you use that power, because that's another thing I think that many of us as network managers, like we want that ability, right? Like that's how we feel like if we can, we're always talking about our member engagement and how to support the people around the table to get their work done, but that also requires like influencing people to come to the meeting and join the work groups and engage around the discussion. And so kind of thinking like what that means to want to have that, and then yeah, how you use that. And then just in terms of, I appreciated, Marietta, how you included the second part of the question of those we work in service to. So again, if it's that feeling of if I am not able to influence or support my members around the table, then how do we get those funding and policy changes that I may also feel an inability to change?
Thank you so much, Selby. Anyone else?
Hi, this is Amy Fellows. Good to see you, Marietta. I put in the chat that it would be nice. It would be nice for I don't know in which, because there's so many different system of care meetings, but to really dig into the power differential between the system leaders and the people that are coming to share their lived experience to influence policy.
That's a great offering, Amy. Thank you. And it's nice to see you again, too.
Oh, I mean, my offering is a suggestion because I'm not in a position of power in these spaces. So.
It is still received. Thank you. Anyone else? All right. We can move along. So the next word is privilege. And I think this is also something that many of us experience in a lot of different ways. Right, so this is specific to unearned social power that's accorded and afforded by formal and informal institutions. And there are a lot of ways that privilege shows up. We all have experiences of privilege in the ways that we engage and move through the world. And so again, this is a popcorn consideration. That's why the picture of the popcorn is there. Just ideas that come off the top of your head. But so like, what are some of the other privileges that exist, and that the ones that may not be immediately recognized, right? So there are some things that that a lot of people don't consider. So if we're talking about able-bodied privilege, being able to move of your own accord and having the freedom to do so. If we're thinking about universal design, if we're thinking about seats that don't fit all bodies, or areas that aren't accessible to all of the way that everyone that people come into spaces, right? So being able to be mindful of what needs people have to be able to feel comfortable in the spaces, right? So if you think about for folks who travel, if seatbelts don't fit all of the bodies, then the seatbelts aren't going to work. Right, so being mindful of small things that some folks may not just consider for any other reasons, because you don't have to think about it until you do. And so it's important to consider when you're working with your clients or even with your colleagues, like, what does it mean to be mindful of the privileges that you hold that may or may not inform or impact how you engage and collaborate with folks in having authentic conversations. And how can you be more attentive to those things, or receive feedback about something that has occurred as a result of something being brought up, right? And so usually privilege is invisible, as I said, to folks who have it, because we are taught not to see it, or we don't encounter it in a way where it's something that we have to be conscious of. But there is an opportunity where it puts folks at an advantage. And to be conscious of that is, I think, very very important in terms of wanting to be authentic in how you show up. And what does it take to be able to be considerate and think of ways where you can expand how you can utilize. I talk about repurposing or repackaging your privilege. What are the ways that you can utilize or repurpose your privilege that will be of benefit to someone else? What does that look like for you in action? And I say in action often because that means it's a tangible outcome that you will actually be able to put your hands on and say, I did that. And I did that because I did this, and because I did this, this was the outcome. Right? So if you're able to say, I spoke in someone's favor, they asked me to speak in their favor, I spoke in their favor, and as a result, this thing happened and they got access to something that they needed. So there are ways that you can repurpose or repackage your privilege that can be of benefit. And again, this is talking, I think there's a lot of, you have to have a bit more, I think it's important to be there's a lot of a self-assessment that goes in this process, right? There's a mindfulness that goes into the process of when you're working with people and providing support to people who have to navigate systems. Navigating systems for a lot of folks, for me even, can be challenging. So being able to support folks as they navigate a system is a superpower. So that might be your superpower. The privilege you have is knowing how to navigate a system and being able to get answers or find inroads and access to things that other folks may not. How can you repurpose that privilege, that superpower, to be of benefit to someone else? All right, a few more terms. So white supremacy, in terms of the concept of the historically based and institutionally perpetuated system of exploitation and oppression, right? I think it's really important to note that a lot of the folks, speak for myself, a lot of the folks that I work in collaboration with or in service to and for are folks who have the experience of being exploited, not doing the exploitation, but of being exploited. And so what that means is to be mindful for me of the impact of generations of harm and trauma and the responses that come from that. While they're immediate towards me or in the moment, the genesis of that is historical. The genesis of that is ancestral. And I'm speaking as someone who's from a community that has that. I've experienced it and I've witnessed it. And yet I'm someone who is in a position to be able to do something different. And so how am I able to navigate these two places and still be very clear that if I'm going to challenge white supremacy, I'm challenging a system and practices that are in place that operate in a very specific way that continue to exploit and oppress folks. So being very clear about how I am working against this kind of silent and very specifically directed exploitation and oppression, it makes it harder sometimes, but it's important for me to be clear when I'm having authentic conversations, when I'm engaging in discussions with multiple diverse communities, right? When I'm talking with Indigenous and tribal folks, when I'm talking with Asian and Pacific Islander folks, when I'm talking to the disability community, when I'm talking to the queer community, when I'm talking to elders, when I'm talking to immigrants and refugees, I have to be really clear about how I approach the conversation and speak from a place of honesty and say, I understand my experience of white supremacy or of these systems of oppression in this way. You tell me what it looks like for you. And if we find alignment or a parallel experience, that's where our connection is grounded and that we have that experience. And so how do we want to share that experience as a generator for us to move forward to create change for you and other folks? You have to be willing to figure out how you're going to be in relationship with folks. Being in relationship is that's part of the work. A lot of folks may not agree with me, and I'm fine with that. But I believe that progress will move at the speed of the relationship you build with the folks you're working in service to. And if you cannot do that in a way that's authentic, you won't move too far. All right. Structural racism and institutional racism. They hold hands a lot and they show up at the same time. They look different. They can feel different. They can feel similar. But again, the impacts of these systems, the end result is that folks are harmed. There is trauma and folks are looking to, they're looking for a different outcome. They want and deserve to have a different outcome. And that the movement that folks are in to create different outcomes that are specific to their communities, their identities, is a valid point when the overall systems have been very intentional about harming. Repair and restorative justice looks different. And so again, it's a concept of being more expansive and understanding what does access look like for the folks you work in service to. You may have an idea in your mind, oh, they want access to more services to get A. And they may say to you, well, actually, I want B. And so how are you able to hear, reframe, readjust, and then support them to get B if they've told you that's what B is? Does that make sense? I'm thinking about the project that Sylvie and I are actually working on together. And we're talking about part of the conversation we're having is active listening. And like people have to actively listen for things. And it is really fascinating to me how many times I come into contact with folks or I'm in conversation with folks who listen to respond. Like I barely get out my last sentence and they're like, but let me say, and it's like, well, wait, no, I wasn't finished, number one. And number two, that actually isn't what we're talking about. Like we're talking about this. And so I think there's a way that you can, when you're talking about these large concepts, or if you're not talking about these concepts, being mindful that these concepts might actually be present in your conversation. It just isn't said, right? Again, be mindful of the taking into account and being mindful of the folks you're working in service to and for. These things are present in the experiences that a lot of the folks have had that you're providing service to. Finally, I just want to offer that social justice, specifically in public health, is an idea that societies as a whole have the responsibility to use the resources and skills they possess to provide for and help every member of the society live healthy lives. And I would add at the end of that, as they see fit, right? So it's about honoring the ability and the autonomy of folks to define for themselves what is healthy, what they want, what they need in order to not just survive, but to thrive. And the last term, I lied, I thought I was done. This is the last term, is intersectionality, coined by Dr. Kimberly Crenshaw Williams, which has largely been used to discuss and talk about women of color or women who identify as Black, Indigenous, and other ethnic and cultural identities. Being really specific in that you can't separate one identity from the other, that they are, that they hold hands and that the experience is unique. And to be mindful of how being able to take into account the multiple identities that folks hold can clarify what privilege and oppression looks like and feels like. And to be able to do that, to be able to take that into account as you're working with folks gives you an opportunity for an authentic conversation, an authentic way to engage, and to be able to move forward in that way. Okay, we can all take a break. You can shake all of that out, like if you want to do a stretch break or, jazz hands. That was a lot of language. And I appreciate your grace because I think it's important to set a foundation of what people are coming into space with. As I do my work, I literally these are the words that I don't have to say, but I'm really clear. Like when I sit into conversation with folks, I'm mindful that there is historical trauma, there is ancestral trauma, there is current day trauma, right? That there are experiences folks have had within the healthcare system that have defined how they engage with them. There are folks who might not be comfortable with me because of my presentation. There are folks who might feel more comfortable with me because of my presentation, right? So that's a lot to navigate. And I also come into this space being very transparent about these are the things I know to be true for me. These are the things I know I can offer to support you. You tell me if any of this makes sense to you, and then we can figure out how we're going to work together. And that no is also a complete answer. I will respect and accept your no because I will offer you the no in the same turn if I'm unable or not willing to do it. And these are ways that you can be in authentic conversation with diverse communities, is to come from a place of transparency and honesty. And so it turns to now the focus of care and where your work lands and how you're able to build these things, these practices into the ways you do your work and the ways you collaborate amongst each other as well. So in your work, as I understand it, You engage with folks across historically and strategically impacted communities. And so one thing I want to offer is to be able to consider the overlapping identities and the related systems that contribute to the resiliency in these communities. Often when I hear a lot of presentations and conversations specific to my work, what I hear is that resiliency is presented as they may think from a strengths-based perspective. Oh, these communities are so resilient, they're so strong, and they really know how to, they come through a lot and they're still here. So what I want to offer is that this actually should not be a starting point to have an authentic conversation with diverse communities. I tend to call it in my passion work, which is I'm a sexuality professional. In my passion work, we call it POC, not POC, but we call it like trauma, the P word. Rhymes with corn. I don't want to say it, but you know what I'm saying, right? So we talk about these opportunities where folks want to utilize the harm or this wonderfully strong sense of a community or a person as a good thing. And not that it isn't, but take into account what it means for someone to be that strong or for a community to always be that resilient. Is that actually strengths-based? If we're considering a historical aspect of trauma or harm that this community has navigated. If it isn't necessarily strength-based, or it isn't the way that they would identify it, how can you be more authentic in your conversation or in the way that you approach it, right? So it's not enough to just work from a harm reduction premise. Harm reduction is important and necessary. There are a lot of ways that you can take the concept and the practice of harm reduction and fold it into your work and utilize it as part of how you engage with your clients and your patients and your community members. Yes, you want to help folks, reduce their use of the ER as the way that they engage with healthcare, right? You actually want to get folks to more preventative care. You want them to get insurance so that they're able to see a doctor or to have a family practice doctor or to have an internist or to have a general practitioner where they're able to see someone on a regular basis to take better care of themselves. Or if you want someone to get dental care, you want them to have access to a dentist so that they have the opportunity to take better care of their oral health. So harm reduction has its place, and it isn't the only premise or the space that you always need to work from. Does that make sense? Okay. So for those of you, this is another opportunity here to check in. What does it look like for you all to change patterns in your work? And I'm quite sure most everyone on the screen with me has operated from a place where you've been like, you know what, this isn't working. Let me try something else. What does that look like in real time for you to change a pattern of how you do your work or shift a direction for how you do your work? What does that look like?
Can I ask something or can
You
I
sure can.
say something? So I'm a parent of two special needs children of color who experience multiple mental health, behavioral health, DD, and medical diagnoses, and both have been at the receiving end of systemic racism based on their race and disregarded diagnosis or refused to get diagnosis because they first said, well, this is a Black kid, so he's just angry. He couldn't possibly have autism, or he's got a conduct disorder at age 3 and he'll be in jail. And these are the types of things that make me irate. And of course, I never even knew that existed growing up white until becoming a parent of children of color and seeing things through their eyes. But I call people out on that because I think in the health community, mental health, behavioral health, DD, most of the providers think that they are not racist and they are totally into and understand equity, but that has not been our experience, and that has not been the experience of many people for whom I advocate and come here today because of. And so I love that you're here doing this, and I love that you're even suggesting that this be incorporated into thinking and day-to-day jobs, etc. But I just don't know how to do this in a way that might be socially appropriate because I go all mother bear, you know what I mean? And so if you have it in your slides, I'll wait. And if you're going to address it at the end, I'll wait. But this just came straight to me when I saw this slide. And so I wanted to ask that.
Well, thank you, Roberta. I honor your sharing. Thank you so much for being willing to share. And I may get to it in the rest of my slides. I have no idea, but I want to honor your ask right now. First off, I think it's really wonderful that you make the conscious decision to call out behavior that you find inappropriate or disrespectful for your baby. So thank you for that. I think accomplished starts when you start small. So the fact that you are saying, I don't like this is inappropriate, this is wrong, for your kiddos is a wonderful thing. I think it's also, what I would offer to you is that if you are able to engage in community space specific to the mental health of the special needs support and the mental health support that you need for your kids, that is culturally specific and relevant. So being able to communicate with Black therapists, counselors, educators, and other support folks and other organizations who can provide support to you, honoring your role as the mother, right? And being really clear about working in collaboration with you to make sure that your kiddos have the support you need. I think that's really key. And there are organizations and places where you can go. And I'm happy to, my email is at the end of the slide deck and you can reach out to me and I'm happy to connect you with folks if that's of any benefit. But I really appreciate you asking that. Thank you so much. Let me get through this really quick. I'm also mindful of time today. So again, talking about the historical and strategic trauma that can happen in spotlighted or sort of like, communities that are centered, they are often given minor assistance to improve or to make a major disenfranchisement or a major occurrence, happen. So it's like, there's someone's house floods and you show up with paper towels. Like, that's not helpful. You might think you're doing right. You actually aren't. They can probably get the paper towels and probably have tried that already. So like, it's being mindful of understanding that isn't the best way to navigate it. Being in relationship and being in engagement, being in a relational engagement is key, especially for what I refer to as melanated communities. A lot of these communities are based on relationship and how you engage and how you show up. And so how are you in your role as a service provider, in your role as a systems of care colleague? What does that look like for you to be in relationship with each other, right? And I'm not saying that you have to be besties and go to the movie that's coming out soon. That's not what this is. Although if you do that, that's great too, because that's another way to build relationship. But I think it's important to be mindful. How are you able to work together from a place of alignment, where you both identify this is key for me and how I want to move forward in my work? Can we work together from this place? Can we build a relationship together from this place? And that in turn, I believe, changes how you navigate your space as a service provider, as someone who's working with communities and families and clients in the community. Because people will then recognize, oh, you know what, Amanda, I saw her at the grocery store and Amanda said A, B, and C, and I really like that. And then when I saw them again, they said, I'm going to get back to you. And they got back to me. And then they tell someone else, because word of mouth is still very powerful in a lot of these communities. When people know that you show up, you keep your word, you do as you say, or you say, I can't do A, but I can provide B. That is the kind of information that is spread amongst communities, and you build a social capital and credibility that can carry you and can support your work going further. And people are able and wanting to work in relationship and in alignment and in collaboration with you. It's also really important to respect and understand the inherent knowledge of the community and their needs. Many of these folks already have ideas or places of support and need and focus that they've identified. They may have said it before in other places. They may have said it to other folks. You might be the person that's actively listening and can hear what they're saying and then translate that into an actionable outcome. So consider what you take away from the offerings that your clients provide to you. How are you able to fold these offerings into the way that you provide services to them and to others? So Roberta's wonderful offering and suggestion, like, what does it look like for her as a parenting person with 2 children with special needs? What does it look like for her to be able to get into spaces and get support for her kids who have a historical relationship and of the system that they are not worthy, that they're not able to be seen, that they don't deserve to have support? What does it look like to absolutely reframe that and say, she actually deserves that support as a parenting person, and her kids deserve that support, and it can come from A, B, and C. And let's figure out how to network and build this network. It may look like you supporting community groups to come together once a quarter, so everyone sees everybody else. That's an actionable outcome, which then provides opportunities for folks to know what's happening. So it can look different, right? And again, you're being in authentic relationship with folks. Again, active listening and engagement impacts the outcome. So it's important to know the impact of your work and where it lands for your clients, for the folks you work in service to and for. Tell folks what it is that you're trying to do or that you want to do. Ask for their feedback. They will tell you. They will tell you. It's just like talking to a young person, a teenager. My 17-year-old niece, I love her down. She knows it. And when she feels like I'm being shady, she says it. Tima, you're wrong. It's my fault because I've raised her to be authentic and transparent with me. So I may not like it, but when I feel like I don't like what she says, I actually have to go look in the mirror because I did that. That's me. But I want her to be comfortable enough to be able to give voice to what her needs are. My job is to hear her, actively hear what she's saying, and then figure out how I can work in concert, in collaboration, to make sure that she gets what it is that she needs. So how are you engaging with your clients to understand the impacts of your outcome and how it lands for them? Is it supporting and accessing the services that they need? And then how do you engage from the places that you represent and hold? All of you hold multiple roles in your communities, in your positions, right? So you're coming with a lot of things already. You're bringing your full self into your position. That's professional. So how do you engage from your professional place and also recognize that personally, you might be impacted by what you're having to do today at work? The fact that you have to navigate a family that might be struggling, that might be a hardship for you in terms of how it feels personally. But professionally, how are you able to navigate that space and still get to the point of where you're providing the service and the care that your client or your patient or your community member needs? What does that look like? How are you able to have authentic conversation with the people you're working with, or with a colleague to say, you know what, today was a really hard day. I had to do A, B, and C, and it felt really bad. And I just need to say that. So you can then pick that back up and figure out how you're going to keep moving forward to get to the outcome that you're seeking, and that is best for your client or your patient or your community member. Does that make sense? Okay. I ask that a lot. That's an old sexuality professional. We always ask, are you with me? Does that make sense? Are we all in the room? So that's just a holdover from that. I think it's also really important to understand that you all work across multiple systems of care and delivery. And so it's really important to note that communities tend to ask for support in the ways they determine what their need is. And I think this is a really wonderful understanding of, for me, as a health equity strategist, I'm asked to think in ways of how to develop strategies to be able to get to a specific outcome. And I'm usually the person thinking, okay, that's great, but did the community ask for this? Where's the feedback from whatever survey that was asked, however many times, with this specific question that spoke to this as the outcome? And so if that's not the case, my job is to simply go show up somewhere. It actually happened today. I was at a conference this morning before I came here this afternoon. And my job, I sat there and I told people, come tell me what you need. I'm not saying I can do anything about it, but what I'm saying is I'm here to listen. And so people came and said, I would like to be able to build community with this. We need a place to meet. We don't have a place where we can meet and come all together, where we can all show up in the same space. We need help facilitating a meeting. We need a place to be able to meet. We need someone to support us and be able to feed our colleagues when we have a meeting. We need a place to be able to bring our peer network folks, and be able to talk without being interrupted by all of the things that we have to carry and navigate as peer support. We actually need to come together and talk about how we're doing it before we go out and do it. So it's important to understand that collaboration is the key to support the healing of the communities that you're working with, and to be able to remove barriers and let them tell you what the barriers are. Yes, there are structural barriers. Yes, there are institutional barriers. Those are real. And in the moment, what I heard today was we need a place to meet. That was the barrier. We can't find a place where folks will let us come and meet. I'm like, great, I can do that. We have conference rooms. We'll schedule some time. You can come to the offices. It's okay. You can meet. It's important to figure out what an immediate barrier is, and if you're able to support that, or what the historical impact or barrier has been, and how you can chip away at that. As my niece tells me often, Tima, you need to play your role. She's good at telling me when I overstep my bounds. She's very good at that. Tima, I need you to play your role. And I'm like, really? Are you telling me I'm being too nosy? No, I just need you to play your role. So I think it's important for me to understand in my work, my everyday work, I need to know my role and how I engage. What am I saying? Am I saying the thing that's going to make the communication between myself and the community member authentic? Are they going to hear me? Am I saying the words that they've heard from somewhere else and those words weren't carried out? So again, it's about being really clear about what does it look like when you're working in community, and being able to support the removal of barriers that continue to perpetuate things that folks engage in. How can you do that authentically? What does that look like for you in your organization? I heard a lot of, I used to work in Multnomah County in the health department, so I'm used to alphabet soup. So I love the alphabet soup that I heard from folks today, right? So alphabet soup was cute as a kid. It's not as an adult. I don't eat alphabet soup as an adult. It's part of my day job because there are all of these things. But what does it look like in your organization to collaborate away from the alphabet soup? What does it look like for me to say, you know what, Amanda, me, you, and Christine, we need to get together and talk about A, B, and C. What would this look like? How can we collaborate beyond this, where we can come together with all of our skill sets, with all of our superpowers to get this thing done? What does it look like to do that? And then how are you able to translate that into actionable outcome for the folks that you work in service to? And what if you ask them? You know, I was thinking about A, B, and C, and I was talking to Christy, and we're thinking about this. How would that work for you? Would that be something that would be helpful for you? They will tell you. People will tell you. And again, active listening, thinking about what it is that you want to accomplish as they see fit. You're supporting what their needs are, not what yours are, what their needs are, within the premise of what you are required to do for your job. So I want to have a quick discussion here for about 10 minutes. I'd love to hear what collaboration looks like in your work. Active collaboration. What does collaboration look like? How does it start? How has it been? What's been good? What's been not so good? But I'd love to hear more about what collaboration looks like in your work. Nobody?
I'll jump in. I'll save you. But I think I want to make sure I'm thinking carefully about my words, but I think in the context of the setup for today in collaboration, those power dynamics, they follow us when we're going into collaboration. And I think that might look differently for different folks in the room, depending on how we intersect with this work. But for me, one of the things that comes up often is collaboration often feels like a very delicate balancing act. I find myself in the middle a lot. And that's not always the most comfortable place to be, but it's an important place that someone be in the middle. Trying to bridge those gaps, but I'm trying to think of a specific example that is not a big feels bad, but I could generalize it to like you know, the CCOs, for example, the coordinated care organizations that hold Medicaid for each county in this community have directives from Oregon Health Authority about areas we are supposed to focus on. And we have to trust that Oregon Health Authority has done their homework to make sure that those directives come from communities and not just from top-down perspectives. Does that make sense? Am I resonating with folks?
Yes. For me,
Um,
I'm
so
not
there's-
asking folks, but it's resonating for me.
Yeah, yeah, that
Mhm.
you as a contractor, as a coordinated care organization might be, or a nonprofit might be, you are beholden to the people who you hold the contract with, and you have to hope that those folks are listening to communities the way you would expect them to. But sometimes you get feedback from the community that that's not how they feel. So that is kind of where that balancing act can feel important.
Thank you so much for sharing for offering that, Amanda. And thank you. I know I've said your name several times in an example, so I appreciate you being willing to come off mic and speak. And I'm also just noticing the comments in the chat. You all are having a really wonderful conversation, and I appreciate what you all are offering here. Did anyone else have anything they wanted to offer?
Yeah, I can really resonate with what you were saying, Amanda. And I think like that really is probably the feelings of a lot of people in this room, given the nature of the system of care coordination that we do. And system of care governance structure itself is a contractual requirement from OHA. And there is this, it's very complicated because we know system of care and the barrier breaking opportunity that comes from it is amazing. Like obviously all of us are bought into that. But the thing that I always get hung up on is when collaborating and like asking for input from the community and then being like, okay, now we have them in this barrier breaking process, but then like it takes a long time to go through the process, and like we actually don't really know what happens with some of these barriers, and it that in itself can feel really performative and not authentic. And so I think that's what I think about when I think about being in this kind of in between space or like towing a line, is trying to keep people's expectations clear and like, you know, really letting them know, like, we don't really know what happens with some of the feedback that you're sharing. And we try to ensure that like leadership knows about these are the things that you're saying you need. But I really liked what you said, Marietta, about having like really holding on to what people are saying that they need. Because I think something that does often happen is like you hear from like the community that this is the need, and then as you bring it through the process, they try to solve it in a different way. You know, like they made it something else to meet the need, and you're like, is that actually what they asked for? I don't think it was. It, you know, now it's just this other thing, but it's just because they're using what they have to try to meet the need. So trying to hold on to that truth of like, this is what they actually asked for, and like hold on to it, I think is something that I can do as like a better collaborator, just like holding truth to that. Like, this is what they said, and just consistently holding on to that clarity.
Thank you so much. Pronounce your name for me. I have a unique name and I don't like messing folks.
Yeah, sure. It's Corinne. Thank you for
Corinne.
asking.
Thank you. Thank you. Thank you for saying that. I think it's so key to continue to remind folks of what has already been said. Like, it's really easy I've experienced it as it being very easy to have an intentional forgetfulness that a question's been asked or that something's been offered, and it's recycled or repurposed and brought up again. And it's like, no, we've actually already been here. We have data to show it, and we have responses that, you know, inform what we've already said. So I think it's really important that that you are someone who's going to be clear and consistent in saying, actually, this has already been said. Actually, this has already been brought forward. Actually, this has already been given voice by this person or this community or this organization. That really does help navigate, again, how to have an authentic conversation and to not participate in erasure of someone or of a community or of an organization's or of your colleagues' work or idea. And that's really key to have. And I think it's going to be even more so considering what may potentially happen with in these next few years, right? To be mindful of what is it going to look like for government and how services may or may not be delivered or identified for communities as we move forward. Anyone else have any offerings that they want to share before we move on? All right.
I do.
Yes, of course, Roberta.
So I think too, you know, I even work for the state of Oregon, and I'm not here as a representative of any state agency or organization, but what I do see, or it's at least my perception, is that a lot of people don't even recognize or even have the slightest concept about white privilege, even though where I work makes sure that, you know, diversity and equity are like at the top of the list of things that we all have to be cognizant of. And so I have to walk a fine line at work in order to keep my job and, you know, not ball people out for what they're saying if it's inappropriate, because, you know, I want to keep my job. But as a mom, I feel more empowered to actually say, do you realize what you're saying is not okay? And you know what I mean? And so I think that there are some avenues that professionals don't even realize that there's any type of racism or inequity happening. And professionally, other professionals may not be comfortable, you know, pinpointing it or pointing it out. And yet it's the responsibility of each of us, even if it's only in our private lives, hopefully it's also at work, to really identify that as we see it and call it out. Because unless we start normalizing it and talking about it and getting through that bit of uncomfortableness, it's never going to change. So I really appreciate your presentation today.
Thank you so much, Roberta. And I really sparkle to what you've offered here, in that at the end of it all, I am of the mind that it is going to take a multi-diverse, multi-expansive collective of people to change what we don't feel is right. I don't believe it's going to be just one. It can't be. It really can't be. It is going to take a multiple, expansive, wide-ranging, diverse, exhaustive process and experience to see the kind of change that I want to see. I know I can't do it by myself, and I shouldn't have to do it by myself. And I don't want to. Amy, yeah.
I've noticed in more recent system of care meetings, there's a focus, which is really important, on leading with race. And it also feels like conversations around disability or ableism have been backburnered. And that feels like that is not a intersectional lens on who our most vulnerable communities are when you think of people of color with disabilities. So I'm really struggling with, in some spaces, like, just how do we continue to have an intersectional lens when people leading the spaces don't seem to understand intersectionality? So that's all I'm offering. How do we have deeper conversations about intersectionality so that we can talk about things like racist ableism and those kind of things?
Thank you so much, Amy, for lifting that up. I think it's really important. I believe that as someone, as a member of a community that has historical trauma, it is my job, as my grandmother taught me, that I actually have to use my privilege to speak up for other folks who aren't present in the room. So I am responsible to say, I'm here for all of the folks who aren't present, who haven't been invited, who aren't at the table, whose voices aren't heard. So a conversation about disability as part of the intersectional lens is necessary. The next step is to bring someone who has that lived experience, that wisdom, that lens, to offer their perspective, to teach me something I don't know. And what does that look like, right? So I often hear, I don't know A, B, and C. And I often tell people, that's actually a lie. I guarantee you, you know somebody who does. You just may not call out their name. You may not know them in this immediate moment. I promise you, if you don't know someone, somebody you know knows someone. 6 degrees of separation is a real thing. And in the spaces where we work, in our work, if we're in healthcare, social services, it's even smaller. You absolutely just have to start asking. And I think that's what's hard and can be very scary and frightening, is that you're going to open your mouth and say something and be afraid you say the wrong thing, be afraid that you might offend someone, be afraid that you don't know enough, and that makes you look a certain way, as opposed to saying, you know what, I don't know enough. Do you know someone who actually does? Can you direct me to the person who does? Because that's who I need to get to. Like there has to be a reframe of the shame.
Oops, you cut out for me. I don't know if for other people. Did the sound cut out?
It did for just a minute. Marietta, I think you're back, but could you just go ahead and speak and we'll check it?
Oh, okay. Can you hear me now?
Yes,
Okay,
yes.
thank
Thank
you.
you so
Thank
much.
you.
Thanks, Amy, for calling that out.
Thank you, Amy. Thank you so much. So I think that's another important point, is that being someone who works in these spaces, showing up, right? You determine what it looks like. So to Amy's point, what does it look like for you to be an advocate, to have a conversation about disability as an intersectional lens in your work? What does that look like? How do you gain access to the people who have the lens that you don't have to be able to teach you something you don't know, but you know you need to know it to do your job better? You know that you need to know this to be able to provide services to the members of the communities that you support. How do you do that? You absolutely, yes, Roberta, you insert yourself into conversations and you ask hard questions.
Which in this space I've been shamed for multiple times.
And that is a real experience and a trauma that then prevents the opportunity for authentic conversations to happen, right? So what does repair look like? You also get to determine what that looks like. What does a restorative practice look like? To repair or to apologize for harm that's been done, and then to figure out how to move forward to restore what can be done next time, right? So that you don't come away feeling that way, or that you can witness that someone else didn't experience what you did because something shifted in how you navigate and negotiate space together in your relationships as folks who provide care to the community and to yourselves. Because as much as you do this work for other people, this work also impacts you, and how you come away from the experiences informs how you're going to show up and do it. And you get to determine what it looks like, right? You get to decide that real change takes time in the ways that you're doing your work. It's not an overnight success. This is an instant oats. This is an instant coffee. This is something where you're absolutely going to have to put your head down and put your hands in the dirt, and you're going to have to work at it. And you're not going to get it right. And you are going to make mistakes. And you are going to say something that might be impactful to someone in a way you had not intended. Your job then is to apologize for the harm, ask the person what would restorative practice is.
You cut out again.
We'll give it just another minute and see if Mariotta's come. There you go.
Am I back?
Yes. Thank-
Yay. Okay. I think it's letting us know that it's at the end of the day and we're all ready to go home. So, yes, your superpowers. So I'm going to go through this quickly. So you get to decide, right, how you show up in your work. You get to decide what kinds of tools you have at your disposal, right, to create opportunities for authentic conversation and engagement. Are they being utilized in a way that allows for change to be rooted in how you do your work? You may not be able to change the folks who may be in power in decision-making positions, but you get to change how you do your work. You get to change that. You get to impact how you make decisions on your ways of engagement with your clients, your patients, your community members, with each other. You all get to create and construct what that looks like. Are there safe and trusted spaces for your clients, consumers, and staffs to have real conversations, right? About your lives and your behaviors, what you're doing right here. This is actually part of the work. I have a lot of people who push back and say, this isn't the work. The work is, it looks like this, and we need to have products that we can show that we're doing our work. This is the work, because when you actually change how you engage with each other, you change the pattern of how your work gets done, because it's going to look different from this moment forward. Are you able to have conversations about accountability, about restorative justice? Are you able to be wrong and say that you were wrong, and then try a new approach to see what the outcome is? These are all practices that you can engage in when you want to have authentic conversation, especially amongst diverse communities. And are you willing to own your views and perspectives and stay engaged in the process of learning? You have to be an engaged learner. You have to be willing to still learn. I don't know all of the things. It is important to me that I remain teachable, especially when it's hard. And for a lot of people right now, it's going to be hard. It's going to be a challenge. It's going to be difficult. Do you have the support to do so? Is there a network of colleagues that you can turn to? Is there a community of chosen folks that you can turn to where you're able to navigate these spaces when it gets really, really different and really challenging? And I encourage you to figure out what that looks like, especially because you're providing service to folks, especially because you're engaging in community with folks. You get to decide, right? Active engagement in the practice of health equity concepts and processes requires an explicit and active commitment. You have to decide that this is the way you want to do your business, not the business of the organization, how you want to do your business, and that it's consistent and that it centers those who are least asked, least represented, and often not present. Because we're all accountable. I heard someone say before, we're all accountable for how we show up and do this work. It's going to take all of us, right? I don't expect anyone to do it by themselves. I don't want to do it by myself. I actually want to be able to say I have wonderful colleagues in different places who know how to do what I do. And let me refer them to you. Let me connect you with them so we can build more relationship to be able to have progress. It's important to provide time and space and the opportunity to talk about race and ethnic identity, because it is very much grounded in how folks experience systems, right? It's not separate. It's not something folks can pull apart. And it may be hard for folks who don't hold those multiple identities, those intersectional identities, but to act like it doesn't impact how work gets done or how decisions are made is actually unacceptable. For me, it's unacceptable. I cannot function in that way. I'm not able to pull apart my Blackness or my femness. I can't do that. I don't want to. And so to engage with someone who doesn't hold those two things together, you and I are not going to have an authentic conversation, because I'm already questioning how you're going to engage with me from that point, because you want me to separate one, or one is more important. They're both valid. They're both necessary. And that's for anyone who holds multiple identities. You do not ask folks to pull themselves apart in order to make it easier for you. And support the development of thinking in terms of the systems and the way that you work in a very different way. Mainstream isn't always the best way, and it certainly isn't the only way. And you have the opportunity to create something different in how you do your work. Again, we can start in small spaces. Baby steps lead to larger steps, leads to a huge leap. And it's important to give yourself that grace as you're learning, but to be consistent and keep moving as you gain more information. And then, you know, the last two, to investigate, model, and promote inclusive models of leadership, decision-making, and engagement. I think, again, here, this is a really great model. I know a lot of a lot of work groups that I've been in that don't have these conversations. They literally do not have the conversations that you all are choosing to actively have every month. That is an active genesis of movement that you all are choosing to engage in. You're consciously deciding these are the things we want to talk about so we can figure out how to do different in the ways that we do our work. And to continue to advocate for resources to support the programs you're working in for growth, for learning, for positions. Again, we're being really technical here. You know, strategic, equitable learning for all staff and equitable outcomes for your clients and patients and community members. You know, it's important to know, as my mother taught me, it's always good to know what you do want, and it's even more important to know what you don't. And to keep those things clear. Are you wanting and willing to learn, being nimble and open, how you want to change, how you want to approach your clients and your community members and how you serve them? Words don't matter if the work isn't being done. At the end of the day, the folks you serve, if they aren't seeing the results of what you say you're going to do, the relationship is not going to be as strong or as fruitful as it could be, right? So be accountable, be transparent in terms of what you're able and not able to do, what you have access to and what you don't, and share the reality of the mistakes, right? If you make a mistake or if something happens, say, I'm sorry, I didn't know, and I apologize. That wasn't my intent. But usually it's the impact that has the lasting effect, not the intent of what you wanted, but the impact of what happened, right? We're all working hard and we're all responsible for how we show up in the work that we're doing. And for folks who aren't aligned in this perspective, this is my last point. I think it's really important. Everyone isn't going to agree, and we don't have to. But what is important is that you have to honor the expertise and knowledge of folks who are most impacted, because it's that information that teaches you how to engage with them, and to understand that your own history shows up and that you're accountable for what you bring into the space. And to repurpose your privilege, to raise awareness, to be a consistent voice of support is really helpful. And if that's all you have capacity to do, it's okay. It is appreciated. Because we need folks who are able to continue to raise awareness. We need folks who are able to be able to help figure out how to get other folks to do different pieces of the work. Everyone has a role to play, right? And so knowing your boundaries and your capacity makes a significant difference in how you can move forward. So I want to appreciate Selby and Christy for their kindness and grace and patience with me and being able to present to you all today. I want to appreciate my HEAT colleagues at HealthShare who are always supportive of my work. And I want to appreciate all of you for a really wonderful opportunity and conversation. I thank you for your kindness. And I hope that you found something that's helpful. And if there's any way that I can be of any assistance or support, feel free to reach out to me. Selby and Christy also have my information. And I wish you all a good rest of your week. Thank you.
We thank you, Mariata. So many important takeaways. Thank you for your time.
Thank you.
Everybody take care.
Bye.
Thank you, Mariata.
Thank you.
Thank you.